Hey everybody, welcome back to the GEMS podcast. Mike Brown. I'm joined today by Christina Philpott. She's here to tell us a little bit about herself and about the classes she's going to be teaching at FDIC and GEMS in the coming April. Christina, over to you.
Hi, everyone. My name is Christina Philpott, and I started in fire and EMS 15 years ago as an EMT at the local fire department. And then I ended up going to school with my medic partner. We both went to nursing school, finished nursing school, and have done nothing but ER and ICU nursing for about 5 years and before I got into the flight world. And then I've been flying now for approximately 9 years at various services. Recently, I have transitioned to a new role and just stepped back in my position in flight. I'm still flying PRN, but I've stepped into a new clinical education training role at a company called Crisis 24, where I am over embedded medics and at different properties around the globe and the United States, and then also doing clinical and training for not only our internal employees but outside clients as well. I was working with Impact EMS teaching the flight medical provider. I was actually at FDIC last year teaching a ventilator course, and then we did a full hands-on clinical course of just all the different skill sets that you need to do in the critical care world, especially if you're interested in critical care medicine or flight med. Last year, I did do a lecture, and then I'm going to be redoing that same lecture this year. It's going to be on basically knowing the basics and how your patient care assessment drives that. How one small piece of information that while you're assessing your patients, such as temperature or understanding a medication or one small detail that you forget to ask, could completely change the avenue in which you think of the thought process of different diagnostic or problem solving that you need to do to take care of that patient. So it walks you through different patient scenarios that will kind of go through a little bit of anatomy and treatment of each one, and how very interactive of how you're going to, if you choose it this pathway or this pathway, how that could potentially change the care of your patient and their outcome. And then my newest lecture this year I'm going to be doing is on aortic emergencies. And we kind of deep dive into the anatomy and physiology of the difference between aortic dissection and aortic distension or any type of problems, and the different like medical treatment that you would use. Basically, if it's abdominal versus thoracic, different medical interventions, surgeries, things like that, in order to better understand the different an aneurysm versus a dissection. So again, just a quick introduction to something that's a pretty scary topic, because most of us in EMS are like, I just need to give this diesel fuel and get out of here. And there's a lot of things that we can do as the provider to make sure that our patient doesn't decompensate from A to B.
Yeah, that's awesome. And yeah, obviously, we're excited to be welcoming you back. And yeah, I'm really looking forward to both of your classes. Particularly where we can concentrate on bringing us back to the basics and those foundational principles and things that we have to understand to effectively manage our patients, and then being also, unpacking some more advanced pathophysiology related to the aortic complications and different treatment modalities for that. So yeah, really excited to be having you back.
Yeah, I'm really excited because a lot of people also try, like sometimes will forget about that, how that combination of the EMT and the medic, or a flight nurse and a flight medic, the different backgrounds and what they focus on really gives you that whole entire picture of how to take care of someone. Because it's going to be that EMT one day that's like, hey, did you check your sugar? And then you're like, oh crap. And then like it was that one simple thing that I missed, or they grabbed the basket of 47 different home meds, and then you're like, oh, good call. And now we have all this extra information in order to kind of help drive our care. So the class last year was really great, and I'm super excited to do it again. We got a lot of great feedback from both first responders all the way up through critical care medics. So that was a pretty interesting, exciting experience.
Yeah, for sure. I'm looking forward to it again, and I'm not too proud to say I have been saved by some very competent EMTs
Absolutely.
who have helped me out in the past. So, all right. Well, hey, thanks for your time today, Christina, and we're looking forward to seeing you in Indianapolis in April.
Awesome. I can't wait to see everyone.